That I was a nurse for 7 years over at LIJ in the MICU. So that was my home for a long time.
I'm Andrea. I am a senior social worker here. I work on the palliative care team. I also completed a part-time medical ethics fellowship. I concluded last July. So I also do medical ethics consultations here. Shout out to Shayna, who's also in our audience today. She is our ethicist assigned to the Central Region. You will be seeing her often. We also work very closely together, but certainly just so you know who the faces are and who's involved in those teams.
And just before we start, by a raise of hands, has anybody seen this phrase before, horizontal violence? Yeah. Okay, so not too many, but um, just a little nursing is a really hard job. It's really tough. Bedside nursing is particularly tough, and it takes a village to care for patients. So team nursing is very important, getting along with your team, working together with your team. You may not have to you may not be best friends, but collaboration is key. And really, at the end of the day, the goal of this presentation is to empower team nursing, empower nurses to look out for one another, and just to create a positive work environment, because it's really hard to come to work every day when it's not a positive environment. Any questions, feel free to raise your hand. If it's something that you guys don't feel comfortable asking in a group setting, we love questions. We love to talk. We work in palliative care. We talk a lot. So don't hesitate to reach out to us. So our objectives of this presentation are to understand the concept of horizontal violence in nursing, the definition, ethical dilemmas associated, and impact on the individual and the healthcare system as a whole. Explore the consequences of horizontal violence in nursing, job satisfaction, retention rates, and the quality of patient care that's provided when this is present. Understand evidence-based strategies and interventions aimed at preventing and addressing horizontal violence, and highlight the importance of fostering a supportive work culture that promotes respectful communication, teamwork, advocacy, and to really mitigate horizontal violence. So just 3 vignettes to kind of start. As we're reading these, read them yourself and just take a minute. It may not reflect something that you've directly experienced, but it might ring some bells of experiences that you've had while you've been working at the bedside. So Nurse Alex has been working on the orthopedic floor for 5 years. They've always provided themselves on their teamwork, but lately things have changed. After a disagreement about patient assignments, the experienced nurse led by the Sorry. After a disagreement about patient assignments, the experienced nurse, led by the outspoken Sarah, had begun giving Alex a silent treatment. They avoid eye contact, refuse to answer questions, and exclude Alex from conversations. The isolation and hostility are taking a toll on Alex's morale and job satisfaction. So, really, just not feeling like your team members have your back. The blame game. Nurse Ben is new to the intensive care unit, eager to learn. They often ask questions to their colleagues. One day, a patient's condition deteriorates rapidly. Despite Ben following all protocols, the senior nurse Emily publicly blames Ben for the patient's decline. The accusation is unfounded, but the humiliation in front of the entire team damages Ben's confidence and creates a tense work environment.
So just taking a second, digesting this, these are all, I'm sure, similar cases that maybe you've experienced, maybe you've witnessed, right? So just kind of putting together what this really is, this topic is about, right? What we're trying to accomplish today and learn about.
And the last one is the gossip mill. So, Nurse Chloe is known for her calm demeanor and excellent patient care. However, she's become the target of gossip amongst her peers. A misunderstanding about a medication error has been exaggerated and spread throughout the unit. Nurses whisper and roll their eyes when Chloe is around, creating a hostile and stressful atmosphere. The constant scrutiny and rumors are affecting Chloe's mental health and job performance. It's really hard when your job is hard and then you feel like the people that have to have your back don't have your back. So these just kind of highlight the more subtle types of horizontal violence. So what is horizontal violence?
30.
It's defined as any hostile, aggressive, and harmful behavior by a nurse or a group of nurses towards a coworker, a group of nurses via attitudes, actions, words, and/or other behaviors. It contributes to an unsafe work environment, poor patient outcomes, and impact on nurses' physical and mental well-being. Um, 87.4% of nurses are endorsed being exposed to horizontal violence. 75% shared that they have physical and psychological symptoms related to this, and 10% say that they actually have been diagnosed with post-traumatic stress disorder related to horizontal violence. So it is really prevalent. And other terms that are used in research to define horizontal violence are things like lateral violence, bullying, incivility, hazing, mobbing, relational aggression, and disruptive behavior.
So, when I first started talking about this topic with Christina months ago, when we brought it up in our Nursing Ethics Council, I had actually asked her, I said, I know nursing has this reputation. Is this really something that actually happens? And we had a whole discussion about it. And even just seeing these statistics, it's really prevalent. And I don't think it's discussed as much as maybe you would expect, considering how much probably every person in this room, everybody on this call has probably experienced this or can at least witness this. So really just seeing these numbers, seeing how intense this can be, and of course, the repercussions for our staff, our patients, and our care.
And I know that this is something, I did an ICU fellowship going through nursing, and the phrasing
Yeah.
always was that nurses eat their young. And it was much worse back then than it is now. And it's gotten a lot better, but it's still definitely there. The pressure, we have hard jobs. So it is something that is ingrained in our culture. And I think Andrea and I found, while doing research for this presentation, this slide really very interesting. This is an international problem. And if you can look at the data here, horizontal violence is really inconsistent in its reporting. The numbers are all over the place. And researchers are finding this is probably related to two issues. If you go back to that previous slide, there are like 10 different terms to define horizontal violence. Until we pinpoint one word and use one word to define it, people aren't going to be able to even realize that it's happening to them on a daily basis. And that brings me to the other piece, which is it so ingrained in nursing culture to eat your young or to not necessarily collaborate the same way that we just feel like it's part of the job. It's part of the day to day. And it made me really reflect on an experience that I had in the ICU working with a younger nurse. I was a charge nurse, and I had watched a preceptor with a new nurse, taking care of a patient on continuous dialysis in the ICU. The patient was so sick on multiple drips. The nurse, it was an isolation room. And I remember having my own patients, doing my own day, and then realizing I haven't seen this nurse since 7 o'clock this morning. She hasn't left the bedside. And when I went over to her preceptor and said, how's Sam doing? She said, well, she needs to learn. And I said, but how does she feel? How is she learn? How is she doing with it? And the nurse said, she's doing fine. She has to learn. And I had gone into the room myself. I had talked to Sam. Sam said, I got to learn. I got to do it. But she was overwhelmed. And that doesn't foster a good learning environment. It doesn't foster an environment where someone feels comfortable going and asking questions. So I said, that you do have to learn. This is something we deal with every day in the ICU, but you don't have to learn alone. There's always that safety net. And that's what we do for one another. So that was always a story that stuck with me of we do have to foster, especially new nurses and going through fellowship and going through orientation. You are going to be faced with these problems. But what's beautiful about nursing is we typically have experience on our side that we can turn to, and we always kind of need that. So examples of horizontal violence, those include withholding information, getting report from the same nurse over and over again. You guys go back and forth. Not nice to each other, leaving out information during report. Humiliation or ridicule, command others to do work that is beyond their abilities, giving somebody an assignment that they've never had to deal with before without the resources to ask questions. Gossiping, neglecting, isolation, talking or whispering behind somebody's back. That's the worst feeling in the world when you feel like people are not there or having your back. Threatening or intimidation. I think refusing to help is a really big one. These are the more subtle things. Discrimination, discouraging enthusiasm, something successful happens and you shoot that person down. Continuous criticism, excessive monitoring of work, criticizing. Well, did you document that? Did you do that intervention? Undermining other success or promotion, blocking access to resources, joking excessively. We joke back and forth, but is there a point where we're pushing the button too many times? scapegoating, physical violence, which we hope that never comes to, and nonverbal aggression. These acts in small amounts might seem harmless, but cumulatively, they really take an effect on patients. Uh, this was identified as a major nursing problem 4 decades ago. They said that it's a persistent occupational hazard within the global nursing workforce. If it was prevalent 4 decades ago and we're still talking about it, it's really important that we identify what horizontal violence is and how we move forward from here.
And especially just trying to normalize talking about it, as well as recognizing maybe the more subtle things that we may not even realize that this is affecting somebody, right? You have a hard job, you're just trying to let off some steam, you're joking with your friends, maybe a newer person comes by, maybe you don't want them involved in that joke, you want to just talk to your friends, you've been working with them for years, this person doesn't understand. But these little things here and there, it adds up, right? And it fosters a really unhelpful and unsafe work environment. It's just, we have to support each other, especially when we're dealing with tough cases. So even recognizing those little things that you may not have even realized could have been considered horizontal violence or bullying, just kind of being cognizant of how you're presenting yourself and how other people might be perceiving you, even if it's not intentional.
God, you got to
So,
walk on eggshells,
why
girl.
is horizontal violence prevalent in nursing? I think I've said it 3 times already. Nursing is hard. We have a heavy workload, cumbersome work content. We're more prone to psychological and physiological stress. Look at COVID. It was really hard. Frustration of the workday, more likely to be taken out on colleagues. You're not going to turn around and yell at your patient, but you might turn around and snap back at a colleague. Job tenure, shift work, different departments have different barriers. Every department in this hospital has its own stressors, and it brings with it its own pressures. Um, Behaviors that are minimized and not recognized can lead to horizontal violence, taking it out on others. Avoidance and isolation are coping strategies, and the perception that the culture is embedded in the field. I always reflect on this as having a preceptor. Being a preceptor is really hard. You have your routine, you know what you need to do in your nursing day to day. You have a tough district, you have a tough assignment, and now you find out you have a new nurse, but you
Oh,
don't have
thank
the
you.
resources to be able to make
Are
sure
you
that they're learning the proper nursing care while you're taking
okay?
care of the
Good
patient
morning.
the way that
Thank
they
you.
need to. And that already sets up a really difficult environment between a mentor and a
Yeah.
mentee to be able to have a productive day.
Leave me
And
all
even
day.
before the shift starts, there may be some signs of horizontal violence. I remember being a nursing intern and getting paired up with the older nurse for the day, and her huffing and rolling her eyes, and me thinking, oh no, this is going to be a long summer. And it ended up being okay. And we'll get to ways to mitigate horizontal violence, but it's just communication, and it comes really down to that. Um, but our job isn't easy, and this is why nurses are more prone to things like this. So the impact on horizontal violence, it's multifactorial, it's individual, and it's health system issues. Psychological symptoms, irritability, anxiety, depression, loss of confidence, diminished self-esteem, increase in substance abuse. I can tell you that there were shifts that I was having difficulty where waking up in the morning is harder, just to go out for your third shift in a row, and it's not looking forward to that next day. Physical and psychosomatic symptoms, fatigue, sleep disturbances, GI upset, or you're getting stomach aches every morning before you go to work and you're chalking it up to caffeine or coffee or sleep. Is it related to work? Headaches, backaches, dizziness, high blood pressure, higher weight, increased rate of chronic illnesses? Research has demonstrated it does have these psychological and physiological effects. Then it's the impact on patient care. The less comfortable we feel with our team, the less likely we are to ask questions, to seek help. This leads to impaired decision making and inadequate or inappropriate nursing interventions. It forces nurses to work in silos, and silos in nursing has been demonstrated not to work. And the effects on retention, it creates disruption and increases turnover. Um, we cost the hospital a lot of money when we leave. This research is from 2015, but to rehire a new nurse and orient them was $22,000 cost per nurse. And then a more experienced nurse was about 64,000. I'm sure this has increased tremendously. Um, but the more of turnover there is, the more that horizontal violence is projected because it's you have to reteach these people. That builds more stress on the unit. That builds more um, tension amongst everybody. So trying to foster a strong and positive work environment from the beginning goes a long way because it keeps people there, um, and it doesn't necessarily change things. I flexed at another hospital and a few times, and I'm not going to mention it because there were nurses there for about 30 years, 30 years, 30 years. Every nurse I spoke to, they loved it. Came back and I flexed probably a year later, and it was a different unit. And I said, what happened? And they just said, you know, I'm not pointing fingers, but leadership didn't support us the way we felt like we needed to be supported. A lot of the older nurses left because they felt like the workload was just the expectations were becoming too high. The newer nurses are all leaving for CRNA school, MP school, and it's just not as cohesive place to work. That team nursing isn't there anymore. And that resonated with me because that's really what fosters a really strong nursing unit and mitigates these types of things.
And what a shame for somebody who's passionate. That's what we want in healthcare, right? We're all here because we want to help people. That's the crux of it, especially for nursing, probably above any other discipline. But when we have people who are dedicated and passionate and they're leaving because they're experiencing something like this and they feel like they can't approach somebody and have a discussion about it, or they can't escalate it appropriately, and how it just continues in the cyclical pattern. It's just really unfortunate when we can get ahead of something like this. And I think this slide's really important, especially because recognizing the psychosomatic, the psychological symptoms that you may be having that you don't even realize are associated with your job. We have such busy lives. You have family, you have other things going on at all times. You may not even realize that, this irritability that you've been having when you get home, or even just, more headaches or GI issues. Maybe start looking at, is it right before work? Is it right after a shift? Are you not able to kind of disconnect from that? And then try to think about your day. Is it something related to staffing? Is it related to just the cases that you're dealing with? Checking in with yourself is so important, but especially if you're noticing things like this in yourself, because you can't address it if you're not even recognizing it, right? It's so important. And increase in substance abuse is certainly a very relevant topic here. What happens? People go home and they say, I'm going to go have a drink. And sometimes that is what you need to take a load off. But sometimes that drink turns into 2, 3, 4, and all of a sudden you're having a bottle a night. And then you're saying, is this really healthy? What am I doing? And I've heard nurses say that to me themselves, saying, I was, especially during COVID, I remember having colleagues say, I was realizing that, one glass of wine a night was becoming a bottle. And even my family had to tell me, hey, is everything okay? And I didn't even recognize it. So these subtle things that you're not even perceiving, check in with yourself, check in with each other, recognize it in each other, and just make sure that it's something that we can address. We're addressing it.
You're not alone. I think that's a big thing, and something that's really important to highlight is, you know, and it took me a long time, probably too long to realize that whatever I was feeling, probably somebody else was also feeling. So, talking about it, you would be surprised how many other people are feeling something that you're feeling on your unit. And I think that it's really important to remember too that nursing is such a powerful group. You're the biggest numbers in the hospital, right? Change can really be fostered through nursing. And I think that's always a really important thing to remember. So there's nothing shameful or nothing to be embarrassed about or hide if you're feeling these types of ways. Find a buddy, find a person, and it goes a long way. It goes a long way. So horizontal violence is really difficult to navigate. We want to try and give you guys the tools and the evidence-based information that we have and how we can reduce horizontal violence. So primary prevention, it takes a village. So RNs taking responsibility for establishing and promoting healthy interpersonal relationships. That comes down to leadership letting people know when they're getting new orientees. It comes down to making sure that the assignments are fair. Comes down to knowing that your buddy next to you has a really tough assignment, so they may need an extra hand throughout the day. It comes down to RNs recognizing that they're not here just to do their job and just to get through their day. It's about working together to help everybody get through their day. Being cognizant of your own interactions, participating in communication education programs when available, making sure that we all have lives at home. We all have things going on at home. If you're not in a great headspace that day, it doesn't mean that you should be taking it out on anybody else. Be honest with yourself, be honest with your colleagues. You don't have to share everything, but recognize that your fuse may be a little bit shorter that day because of what's going on in the outside world. and be transparent. Today's not my day. I'm going to do what I need to do. You let me know if you need help, but I'm having a hard time today. And the education-based programs that we have through Northwell are excellent. Through iLearn, I forget.
CLI. I
Yeah.
mean, there's so many different ways and avenues that you can broaden your skill set, learn different techniques. I mean, I did one, I think 4 months ago, I did a CLI and it was great. It's just why not? Why not encourage and continue to foster our own growth?
Creating norms of a civil workplace. We should never start people's careers thinking it's okay that it's a hostile place to work. I was on a unit the other day and the unit receptionist was screaming at a nurse and it caught my attention. And it wasn't somewhere that felt like a safe place to be. And I felt for that nurse and kind of took a different avenue, but work should be civil. We're all colleagues and we should treat each other that way. Becoming familiar with workplace policies and understanding how to escalate lateral violence in real time. We'll go through that shortly. Creating agreed upon code word or signal when feeling threatened. And this is a question. I don't know if they still teach cuss, concerned, uncomfortable safety issue. And
Great.
I'll go into that on a second slide because I have some experience with that. But having that code word goes a long way. And I really feel strongly about that. And advocating at the educational and professional level for further education to prevent horizontal violence. That is from nursing school beyond, this should always be reinforced because when you haven't been reminded of something, you start to lose sight of it. This is something that follows us across the career. I've seen 60-year-old nurses be mean to 20-year-old nurses. I've seen 20-year-old nurses be mean to 60-year-old nurses. And I've seen people, doesn't matter what age you are, it follows you throughout the career. So it's something that we should always be reinforcing and reminding ourselves that is prevalent. So the ANA, the American Nursing Association, actually has best practices when it comes to horizontal violence and primary prevention. These are things we should be doing in our daily day-to-day, but it's not a bad thing to review. Using clear communication, verbal and nonverbal. Don't be evasive. Be straightforward, be direct, be polite, but be direct. Treat others with respect, dignity, collegiality, and kindness. Consider how words and actions affect others. You may have thick skin, but somebody else that may really hit home for them. So keep that in mind. Uh, Avoid gossip and rumors, rely on facts, not conjecture. If you hear, oh, Susie did this overnight and it was terrible and it led to this rapid response, get the facts before you go and tell the next nurse that because it can always become a gossip mill. Collaborate and share information when appropriate, offer assistance when needed, and if refused, accept with grace. I think that one is something that I kind of went, huh, because I remember being a charge nurse running around like a lunatic when I had all that energy, wanting to help everybody. And then someone would be like, I don't need your help. And I'd be like, why don't you need my help? Or why don't you want my help? And, but if they don't need your help, that's okay. You offered. It's not because they don't like you. It may be because they've got it. So keep that in mind and accept it with grace and always ask again. Just because they said they didn't need your help today doesn't mean that they don't need your help tomorrow. Take responsibility for one's actions. I think that we've been doing that, and I think another really good thing are the identifying what kind of day you're having by what color you are goes a long way with that, recognizing the stress that you may be carrying that day. Abuse of power or authority is never acceptable. Speaking directly, demonstrate openness, being polite, encouraging and supporting others, and especially when you're mentoring somebody, have a little bit more grace. It's really scary to be new. Listen to others with interest and respect, and follow the ANA Code of Ethics. And the ANA Code of Ethics, I think it's so important. It's something that we should all know, but I'm going to take a minute and read the 9 provisions because if you're feeling really tired and you're like, why did I do this? Why am I working in nursing? This is why. I think that they really highlight what our responsibilities are and the big reasons why all of us went into nursing. So, nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. The nurse's primary commitment is to the patient, whether an individual, family, group, community, or population. The nurse promotes, advocates for, and protects the rights, health, and safety of the patient. The nurse has authority, accountability, and responsibility for nursing practice, making decisions, and takes actions consistent with the obligations to provide optimal care. The nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth. The nurse, through individual and collective efforts, establishes, maintains, and improves the ethical environment of the work setting and conditions of employment that are conducive to safe, quality health care. The nurse, in all roles and settings, advances the profession through research and scholarly inquiry, professional standards development, and the generation of both nursing and health policy. The nurse collaborates with other health professionals and the public to protect human rights, promote health diplomacy, and reduce health disparities. The profession of nursing collectively, through its professional organizations, must articulate nursing values, maintain the integrity of the profession, and integrate principles of social justice into nursing and health policy. Now, not all of them may hit home all the time, but they're important. They're important to review and to remind yourself as to why you got into nursing. It's to make a difference in people's lives. It's that direct, daily bedside care that you guys are doing. So it's really important. And if ever you're having a hard day, this may not make you feel better, but it reminds you why you're
Sometimes you need that reminder. I think every field needs that, right? You go into this for a reason and then you get distant from it. You're growing, you're moving, you're so busy. Sometimes we don't take a second to say, why did I do this? Why did I dedicate my life to this? And I think that this is a really great way to take that time to just reflect on that. And maybe it helps you refocus a little bit about why you're really here.
So secondary prevention, it's happened. An event has happened. Respond directly to the perpetrator, seek guidance and support through the proper channels. When it's possible, do this privately. It doesn't need to be an embarrassment, doesn't need to be a scene. Something happens, try and address that person and do it in a private controlled setting. Using the pre-established code to seek support when threatened. I'll go through that one. RNs who observe horizontal violence should consider letting the perpetrator know actions are not consistent with policy. And leaders at all levels must support the efforts to prevent further incivility and develop action plans to address these issues. There was a crazy statistic in the Bambi research in the beginning that said that most nurses that experienced horizontal violence, they felt that 77% of the leaders were aware that horizontal violence was occurring, but didn't act on it, which kind of said, and those nurses felt very unsupported in that research. So I think that leadership has a really big role in trying to prevent this, but also when it happens, address it directly. And then offering stress management and stress reduction when associated with fatigue, recognizing burnout, and prioritizing an ethical and balanced work environment. Now, I want to bounce back up to a pre-established code. When I went through orientation and I learned you cuss somebody, you're concerned, you're uncomfortable, it's a safety issue, I was like, I'm never going to use this. This is the craziest acronym. I'm not going to turn to somebody and say, I cuss you. So I'm on night shift. I'm a nurse, probably 6 months in. I have a medication on blood pressure support medications in the ICU. Blood pressure is borderline stable. I'm titrating it to the order. I'm following all the things that I was taught through my fellowship. And all of a sudden, a seasoned charge nurse comes in and boop, 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 down titrates my blood pressure medication. I know that we're desperate for beds, but going down a little bit too aggressively for my comfort. She's an older, more experienced nurse. I have a lot of trust in her. So I wait a minute, patient's blood pressure drops. I go back in the room, I go back up on the blood pressure support medication. Go in my other room, on the monitor, I see my patient's blood pressure in the other room is low again. So I go back in, my pump is different than where I left it. So I go back up, I go on through my day, and then finally the nurse goes back in and touches it again and goes, we need this bed. This patient is stable enough. They need to go. So I said, I don't think that that's the right thing to do. I'm going to continue to follow the orders and, you guys have to find a different ICU bed because this patient still belongs in the ICU based on their blood pressure. Go on with my day. I'm in my other room again. Same thing happens. Blood pressure's low, pump is changed. Finally went up to her and I said, I'm concerned, I'm uncomfortable. This is a safety issue. I'm cussing you. And I give her a lot of credit because that was a hard stop. Everything stopped. We spoke about it. I said, I don't, as a responsibility of the nurse for this patient, I have to follow a specific order set. I have to try and achieve a MAP of 65. I think it's a safety issue to continue to go down on the blood pressure support medication when it's not clinically indicated. At this point, she said, I think we should involve our leadership. We involved our leadership. We spoke about it. Um, and that was a hard stop. After that, we all agreed that whatever patient was waiting for an ICU bed had to board in a different unit. This patient still was clinically indicated to be in the ICU. And it facilitated a conversation that we weren't having before, which is, I think that you are making my patient become a safety issue, or I have to advocate that this is becoming a safety issue. I never thought I would use it, and I never thought it would work, but it does. And if somebody doesn't respect that CUS, uncomfortable, I'm concerned, uncomfortable safety issue, escalate that to leadership, because that is a hospital standard and policy. I think it's a system-wide policy. So it really does work, and it really does. If somebody does it to you, that should be a hard stop. Even if you don't think that it was appropriate, that should be a hard stop. Let's get somebody down and mediate this so we can figure out how to move forward from here. And we collaborated and worked well together, and we still maintain a relationship with that. I maintain a relationship with that nurse 9 years later. So it's a hard job. Sometimes we do things that aren't right, and we move forward from them. Tertiary prevention. So reporting an event as soon as possible, keeping detailed accounts of the incident. If there's a pattern, if there's a pattern and things are happening on a regular basis, include dates, details, and witnesses involved, just in case it does become a bigger issue. Obtain support through employee assistance programs or the medical ethics team.
Yeah, we're here. We're here. We're
Um,
happy to help.
for
Yep.
counseling and further guidance, and we'll dive into that a little bit.
Yep.
Providing support to colleagues who have experienced lateral violence. If you know somebody is not being treated well on your unit, don't join in and don't just sit idly by the wayside. That's a really bad feeling to have or to experience. They shouldn't be alone. So try and recognize that that person may need a little extra support. And recognizing one's own actions, apologizing, making amends, initiating changes to transform the way we interact with one another. I'm not saying that I'm perfect and I was always on the other side. I am sure that there are times where I was not as patient with my intern or resident or orientee that I could have been. And I think that recognizing how important the nursing field is and how important team nursing is, um, taking a step back, thinking about the day that I had so that tomorrow I don't bring that same person to work that day, is a really big step. So really doing some self-inventory goes a long way to make sure that you're not making anybody else feel terrible.
So what's the role of leadership in managing these situations? Because obviously it's twofold, right? You as a person who's experiencing this or as a victim of this, you need to advocate for yourselves. You need to make your needs known. People can't read your mind. They don't know necessarily what's happening day to day. And I know there's always a big jump to say, well, if leadership would just get involved, if leadership could just help with this. And sometimes that could certainly be the solution. But again, are they even aware of what's going on in your unit? Do they even know the dynamics? So especially for our leaders, you are well equipped to handle this kind of situation, to create a safe, welcoming environment of shared learning, care for our staff. You do this each and every day. That is how we work in this kind of facility. But we just really encourage our leadership to utilize conflict mediation strategies, just like you would normally do, but really try to do that in a supportive way, right? Reassuring, protecting those who are escalating concerns. If you're able to stop any type of retaliation, please be cognizant and aware of that and try to be a little bit more, on top of it, as well as allowing outside neutral disciplines like medical ethics or even Code Lavender team to just kind of assist in conflict resolution. You're not alone in this either, right? Just because our bedside nurses are not alone doesn't mean our leaders are alone either. And especially medical ethics, we are able, we're willing, we're here, we're sitting here right now today. We are able to be there as just a neutral body who can say, tell me what's going on. Tell me from your perspective. Let me try to understand this and reason how we can make this a little bit better. That can take you out of it if you're the leader, and that maybe you have a good relationship with one staff member, maybe you're not as close, maybe it's a newer nurse you're getting to know, and you want to remove yourself from that situation. We want this to be, again, a cohesive environment. So if we can help foster that, we are able and willing to. You just have to let us know. So keeping that in mind, our nursing partners, You can even call an anonymous ethics consult. You don't even have to disclose your name. You just have to tell us where you are, what's going on, and then we'll connect with your leadership, with your team, and we will see how we could be helpful. So there are so many ways that we can even help to provide that support and guidance. And again, our Code Lavender teams, you know them, you've worked with them. Just having that space that says, I'm looking at you. How are you doing? Can I support you in this? We're so good at supporting our patients, and we're so good at our families and connecting with everybody. Let's take some time for ourselves. Let's make sure we're prioritizing that need as well. So utilize your resources. Continuing with this, there are some other strategies that we've been talking about. And just like Christina said, clearly some of these strategies actually work. So keep an open mind, see how it goes. But strategies that you can utilize that can strengthen this kind of supportive environment, authentic leadership, skilled communication, right? Broadening that skill set if it's something you want to work on, true collaboration, not just saying things, but doing things, effective decision making, and appropriate staffing that matches the patient's needs, as well as meaningful recognition. Let's be excited when somebody does something great or does something the right way, or maybe they were scared about a patient that maybe they haven't managed something like that before and they did a great job. Let's acknowledge that, let's honor that, let's be excited, let's support one another. And again, trying to make sure that we're checking in. If you have a hard assignment for 3 days in a row, did you let your leadership know that maybe the next time you're on shift, is it possible to be elsewhere? Maybe I need a break. And that's okay because we are human at the end of the day. Taking those breaks is so essential. Your patients need it, but so do you. And then consider implementing institution-based incentive programs, which we will talk about next.
So with all of our research for this presentation, the number one evidence-based practice um, res results showed that institution-based incentive programs are the most effective way for units to reduce horizontal violence and have positive workplaces. These can institution-based incentive programs, having a lockbox, addressing issues during staffing meetings, making it a safe workplace to express your concerns is a really important piece of this. Anonymous surveys measure the perspectives of the workplace, suggest on how to combat these issues and gain a better understanding of the situation. My old unit had a box, and what the box was what's the issue and can you provide a recommendation for it? Can you provide a solution? Can you think of a solution? And it really helped. And those were gone through at every shift meeting. And it was a really good way to make sure that we had open communication. Our biggest issue, and I know a lot of units' biggest issues were staffing, and that's the staffing was leading to the stress, and the stress was leading to this really incohesive work environment. And as we addressed that, it became a more open conversation. We did try to address staffing issues the best we could, and it does go a long way. Big thing is don't ignore the results. Create a task force to determine the best strategies and utilize your team members who would benefit from the changes. Zero tolerance policies with horizontal violence are really important. Lines of communication must clearly convey that horizontal violence will not be tolerated. It's not healthy for the unit, it's good for the patients, and it's not good for the nurses. And again, nursing leadership plays a pivotal role creating a safe environment and being approachable for staff to report possible incidents. The big thing is if things are going well on your units or you recognize nurses that are going above and beyond to support nurses that may not be the most popular on the unit or the best on the unit or get the best assignments, recognize that and address those nurses and make sure that they feel just as supported as the nurses that are very comfortable on that unit and have those positive experiences. A lot of this is rewards through the paid time off and bonuses, which we know is not realistic. Things like recognition points. If you know that the nurse's favorite coffee is downstairs, bring them a coffee that day. Small little tokens like that go a long way in showing that you're important, that you're recognized, and it makes coming to work every day a little bit easier.
So what are other helpful techniques? So some things like skill development, which we've been talking about, broaden your skill set. That is so essential. Just because you've been in this field for 5, 10, 15, 20 years doesn't mean that there's not stuff for you to learn. So especially how to interact with one another, how to communicate well, those are great skills that you can continue to learn and expand upon. But educating your staff, utilizing resources like books, interactive training settings, like we were talking about CLI, things like that, they'll encourage assertiveness and negotiation skills to help manage these disruptive behaviors. If we can train our staff on how to actually advocate for themselves and tackle these issues, maybe we could prevent some of this from even happening to begin with. as well as empowerment, right? This is so essential. Structural empowerment provides nurses with access to things like information, more opportunities, resources, support, and they can prevent those attempting to take power over a situation or from other nurses from actually being successful. If we empower one another, we can really make some substantial changes to how our culture is. So, keeping all of this in mind, and again, for our leaders, encouraging your staff to try to utilize these skills, and for our nursing partners, do this. Do whatever you can to broaden your skill set. Read up, watch some documentaries, do an interactive training program, see ways that you can kind of develop those skills, and also recognize the fact that you're human. So, again, it's okay if you have a bad day, but advocate for yourselves, connect with one another. So, what are some of the ethical implications of horizontal violence? Because again, it's such a nursing issue, but there are ethical side effects that we're seeing in these daily situations and cases. Horizontal violence is as much a nursing issue as it is an ethical concern. So, when this type of bullying behavior occurs, it can negatively impact patient outcomes as well as increase issues like burnout and retention. Staff may be less inclined to escalate ethical or medical concerns that they're seeing on their units, as well as with their patients, because they might be feeling burnt out. They might be afraid of retaliation. They might just be dissatisfied. And again, if they make those needs known, maybe we can actually fix that or help improve that atmosphere. So it's so essential that we tackle this head on because the repercussions are really significant. Your patients and your families need the best version of you. You may not always be able to provide that, but acknowledging those times that you can and seeing if there's a solution that we can come up with to help you get back to that place. And then just again, back to nursing leadership, it's crucial that our leaders are able to screen for these potential situations and cases and incorporate ancillary supports whenever possible. Our chaplaincy team is so approachable. They're so lovely. They can help you if you're really feeling burnt out or feeling really distressed. The employee assistance programs that you can call and just get that extra perspective, as well as, again, medical ethics. We're here, we're available, and we're able to help you mediate those situations. It could even just be a call saying, can you just check in on this one unit? There's been a lot of distress. There's been a really heavy caseload. They're really not doing great. And we're starting to see them kind of attacking one another. Get us involved early. We're here. We want to do that.
And I'm not from the ethics department. I work with palliative care, but we work very closely with ethics. I think that they would be a great resource in a situation like this. They're unbiased, they're neutral, they're really here as that support. So, both for leadership and nursing, I think that if you're concerned about horizontal violence on your unit, you're not even sure how to attack it, they're a really great resource to help you guys.
Because we're also an interdisciplinary team. I'm a social worker and I'm an ethicist here. We have masters of public health, we have attorneys, we have physicians, we have nurses, we have nurse practitioners. We have so many different disciplines within that department. We can also meet your needs based on what the situation is. Try to make sure that the right person can help connect. We can be creative. So we just need to be told where to go and how to help.
And then we started with 3 vignettes, so we'll end with one last vignette. The tension on the med surge floor was palpable. Whispers and side eyes exchanged between the seasoned nurses and the new graduate, Sarah. A seasoned nurse, Evelyn, had made it clear she disapproved of Sarah's presence, her clipped tone and dismissive comments a constant undercurrent. One afternoon, a patient's condition deteriorated rapidly. Sarah, calm amidst the chaos, initiated the rapid response, her voice clear and confident. Evelyn, instead of assisting, muttered through her breath, "Newbie thinks they know everything." Sarah's hand shook slightly, but she focused on the patient. Later in the break room, Sarah's eyes were red rimmed. A sympathetic coworker mentioned the incident to the unit manager, Emily. Emily, a seasoned nurse herself, knew the signs of horizontal violence well. She called a private meeting with Sarah, validated her feelings, and assuring her support. The next day, Emily addressed the entire unit. Without naming names, she spoke of the importance of teamwork, respect, ethical practice, and professionalism. She emphasized that everyone, regardless of experience, had a role to play. Evelyn's face flushed, but she remained silent. Over the following weeks, Emily initiated team building exercises, encouraging open communication and conflict resolution. Slowly, the atmosphere shifted. Sarah gains confidence, her skills recognized. Evelyn, though grudgingly, began to include Sarah in discussions. The tensions didn't vanish overnight, but with Emily's unwavering support, the unit culture began to heal. It wasn't a perfect resolution, but it was a start. And for Sarah, it was a testament to the power of leadership in transforming a toxic environment. And I think what really is important here to highlight is re- things happen. Sometimes they're inevitable, but knowing that something is being recognized and done to try and mitigate it from happening again is
Yes.
really important. Um, so this is our contact information. Please don't be shy, like I said in the beginning. We're always happy to take questions, concerns, anything via Teams, via phone call.
That's Shayna's name. You can Teams her, you can Teams any of us. She's there. If you're in person, she's here. But we are all here to just support you. So you just have to, again, just let us know, say the word, and we will be there and do whatever we can.